Hello and welcome to this presentation. Platform name is Blackboard Research and Education Foundation, and I will be your presenter today. Today I will discuss about another topic is visual field examination. Visual field testing is an important diagnosis tool used by ophthalmologists to assess a patient visual function. A visual field refers to the entire area that can be seen by the eyes without moving the head. A normal visual field allows an individual to see objects in all directions, including the periphery. So today I will discuss about our eye visual field. What is the definition? The definition of the visual field. The visual field refers to the total area in which object can be seen in the sight periphery vision as you focus your eyes on a central point, or it is that part to environment wherein a steady fixing eye can detect visual stimulus. This means the basis of visual field testing is to measure the range of visions, the sensitivity of the visual system, and any defect and abnormalities in the visual field. This is typically done using a specialized instrument called a perimeter, which is equipped with the computer and a display screen. During a visual field test, the patient is asked to look straight ahead with a series of light of varying intensity and brightness and presented a different location within their visual field. The patient then passes a button or indicates when they see each light. The information is then analyzed by computer to create a map of the patient visual field. Normal limits of the visual field vary depending on several factors, including age, sex, and other individuals' characteristics. However, the average visual field extent of approximately 60 degrees superiorly, 70 degrees inferiorly, 60 degrees temporally, and 100 degrees nasally. These measurements are taken from the fixation point, which the point at which the patient is asked to focus during the test. Visual field defect can occur for a variety of reasons, including the disease such as glaucoma, retinal detachment, and optic nerve disease that is called optic neuritis, as well as neurological conditions such as stroke and brain tumor. This defect can cause the loss of periphery vision, blind spot, or other visual disturbance. In conclusion, visual field testing is a circular diagnostic tools that help assess a patient visual function, detect defect or abnormalities, and aids in the diagnosis and management of eye and neurological conditions. Visual field examination. A visual field examination is a diagnostic test that measurement the extent and sensitivity of person visual field, which include both central and peripheral vision. During the test, the patient is typically seated in front of a mechanical that project a series of light or target onto a screen. The patient is then asked to indicate when they see the lights or target by passing a button or verbally response. By analyzing the patient response, the examiner can map out the patient visual field and detect any areas of reduced sensitivity or blind spot. This information can be used to diagnose and monitor various medical conditions that affect the visual system, such as glaucoma, stroke, brain tumor, and other neurological conditions. It can also be used to assess the progressions of those conditions and to determine the effectiveness of treatment. Visual field testing can be involve various simultaneous and similar and testing method. Here are some more details. Stimuli, visual field stimuli. First one, size, target of different size can be used to test different parts of the visual field. Smaller, larger target are used to test central vision, while larger target are used to the peripheral vision. Intensity, under this stimuli intensity, that target of different intensity can be used to test the sensitivity of different part of the visual field. Dimmer target are used to the test for early signs of visual field loss, while brighter target are used to test for more sensitive several visual field loss. Stimuli under color, that targets of different color can be used to test different aspect of the visual field. For example, blue-yellow target can be used to test for early sign of glaucoma. Next, number 2, field testing method. Field testing method, kinetic, under the kinetic testing. Kinetic testing, this method involves moving a target from a non-seeing area into a seeing area and then out again. This maps the controller of the visual field at different level, resulting the one isopter for each level testing. Under the field testing method, static testing, this method involves presenting targets of different intensities and size at fixed location in the visual field. The patient is asked to indicate when they see the target, and the responses are used to map the vertical counter of the visual field along a selected meridian. This method is more precise than kinetic testing and is commonly used in clinical setting. There are also other types of visual field testing modes, such as frequency doubling technology and multifocal electroretinography, which are used for more specific diagnostic purpose. Clinical testing method. Here I am showing one video that is showing the clinical testing method of visual field. Confrontation visual field testing is a simple and quick method to test a patient's central visual field. It involves the examiner standing in front of the patient and holding up their fingers in various positions within the patient visual field. The patient is then asked to indicate how many fingers the examiner is hold up. This is done on one eye at a time, which the other eye occluded. The type of testing can detect a gross visual field defect, but is not as sensitive or specific as other visual field testing method. It is usually performed as a screening test in a routine eye exam or as a quick assessment of visual function in a patient with suspected visual impairment. It is an important note that a confrontation visual field test is not a substitute for more comprehensive visual field testing method such as automated perimetry or Goldman visual field testing, which are necessary for detecting more subtle or peripheral visual field defect. Next is Amsler grid testing. Here I am showing Amsler grid testing. The Amsler grid is a simple and effective method of testing for the central visual field. It consists of a grid of interesting line of fixing point in the center. Patients with macular disease, such as age-related macular degeneration (AMD), may experience distortion or scotoma, blind spot, and also blind spot in their central vision, which can be detected with their Amsler grid. During the test, the patient is asked to look at the center or dot and report any abnormalities in their appearance of the grid, such as missing of distortion line. This test can detect central and peripheral scotoma as well as the other type of visual distortion. The Amsler grid is often used as an screening test for macular disease or as an way to monitor the progression of the disease over time. However, it is important to note that the Amsler grid is not a substitute for a comprehensive eye exam, which may include other visual field tests such as automated perimetry or Goldman visual field testing to detect more subtle or peripheral visual field defect. Peripheral testing. Peripheral testing, perimetry is a method. Peripheral testing is under the perimetry. Perimetry is the method used to test the entire visual field, including the peripheral vision. It involves presenting a series of stimuli using small point of light or other shapes at defect local or location on a screen while the patient focuses on a central fixation point. The patient is then asked to indicate when they see the stimulus by pressing a button. There are two types of perimetry, static and kinetic. Static perimetry involving presenting stationary stimuli of different intensity and size at fixed location in the visual field. The most common type of static perimetry is automated perimetry, which used computerized systems such as the Humphrey field analyzing to present stimuli and record the patient responses. This type of testing can assess various amount of visual field, ranging from 10 degrees to the full field. Kinetic perimetry. Kinetic perimetry is a visual field testing method that involves moving a stimulus such as a small object or other light from a non-seeing area into the patient visual field and then out again. This is used to map to counter of visual field at different level, resulting in one isopter for each level tested. During a kinetic perimetry test, the patient is usually sit about 1 meter from the screen or a board with a central fixation point. The eye that is not being tested is covered to eliminate any potential distraction. The examiner then moves an object or light along the predetermined path, either from the periphery towards the center or from the center towards the periphery, and the patient signals of when they first see the object or light. The size of the stimulus can be varied, and the examiner may use different color or intensity to test different aspects of the patient visual field. The Goldman perimetry is an commonly type of kinetic perimetry device that usually use a small white lighted target and a series of graduated concentric circular to measure the patient visual field sensitivity. Kinetic perimetry is used to detecting a monitoring various eye condition including glaucoma, optic nerve and retinitis pigmentosa that can cause visual field defect. However, it is a time consuming and subjective test that required skilled examiner and cooperative patient. Primary visual cortex. The primary visual cortex, also known as V1 or the straight cortex, is located in the occipital lobe of the brain, specifically in the calcaneal area. This area is the terminus of direct visual signal from the eyes, and it is responsible for processing and analyzing visual information from the retina. The visual cortex is organized in a systematic manner, with different areas of the cortex representing different parts of the visual field. In the primary visual cortex, peripheral retinal representation occupies the another part of the cortex, while the macular representation occupied the posterior part of the cortex near the occipital pole. The upper portion of the retina is represented in the superior part of the visual cortex, while the lower portion is represented in the inferior part. This retinotopic organization allowed the brain to create a detailed map of the visual field, which is essential for visual perception and recognition. Damage to the primary visual cortex can result in various visual impairment such as blindness, visual field defect, and different recognizing object or face. However, the brain has the ability to recognize and adapt to change the visual input, and with rehabilitation, some visual function may be regained. Extra straight visual cortex. Beyond the primary visual cortex, the visual information is processed and analyzed in various regions of the extractive cortex, which include Brodmann's areas 18, V2, 19, 21 and 22. The thalamus project to layer 4 of the primary visual cortex, Brodmann's areas 17 or 6, and the visual information is then processed and sent to different locations in the extra straight cortex, which or where it is further analyzed and integrated with other sensory information. Brodmann area 18, also known as B2, is involved in the analysis of visual meaning such as color, text, texture and font. The extra straight cortex also included two main processing stream, the dorsal stream and the ventral stream. The dorsal stream, which includes the middle temporal area, is involved in spatial recognition and the analysis of the visual scenes, such the movement of object and the perception of depth. The ventral stream, which includes the posterior infratemporal cortex B4, is the involving in object recognition, the guidance of action and the perception of the spatial characteristic of the environment. This stream is essential for recognizing object and face. and for understanding the meaning of visual information. Visual deprivation refers to the loss of visual input to the brain, which can occur due to various causes, including congenital or acquired conditions such as cataract, ptosis, or corneal opacities. There are different types of visual deprivation, including stimulus deprivation, strabismic, isotropic, and isometropic and anisometropic amblyopia. Stimulus deprivation occurs when one eye is completely deprived of visual input early in life due to congenital and acquired conditions that block or impede light transmission to the eye. This can result in the development of amblyopia, a condition in which the visual acuity of the affected eye is reduced. Strabismic amblyopia occurs in children with unilateral constant squint, which one eye is suppressed due to prolonged discussion. This can lead to a reduction in the visual acuity of the defected eye, as well as impaired binocular vision and depth perception. Isometropic amblyopia occurs in children with bilateral high refractive error that is left untreated. These can lead to reduced visual acuity, and the development of the amblyopia is in both eyes. Anisometropic amblyopia occurs when there is a significant difference in the refractive error between the two eyes, which can lead in unique visual input and the development of amblyopia in the eye with the higher refractive error. Visual adaptation. The human eye visual adaptation is the ability of the human eye to adjust to the change in luminance, which is intensity of light or brightness. During dark adaptation, the eye becomes more sensitive to light and improves its ability to detect low level of light. During light adaptation, the eye becomes less sensitivity to light and adjusts to bright light conditions. This adjustment occurs in the retina, which is the light sensitivity part of the eye that contain photoreceptor cells called rods and cones. Rods are more sensitive to low light. Cones are responsible for color visions and are more sensitive to the bright light. Dark adaptation. Dark adaptation is indeed the process by which the eye adjusts to low level of illumination, such as when going from a brightly light area to a dimly light area. During dark adaptation, the sensitivity of the retina of light increases as the cones in the eye adjust to the lower level of light. As you mentioned, rods are more sensitive to low level of light and are responsible for scotopic vision, which is vision in low light condition. Cones, on the other hand, are responsible for photopic vision, which is the vision in bright light. The time is taken for the eyes to fully adapt to the low level of illumination is called the dark adaptation light, and it varies from person to person. It typically takes several minutes for the eyes to fully adapt to dark, but it can take up to 30 minutes or more for some people. During dark adaptation, the eyes become more sensitive to light, but at the same time they also become lost sensitivity to color. This is why big object, many appears gray or black in very low light condition, as the color receptor in the cones are not as active. Overall, the dark adaptation is an important process that allows us to see in low light condition. Mechanism of dark adaptation. The process of dark adaptation involves change in the visual pigment, but as you mentioned, there are several other mechanisms at play in the additional to the recognition and of visual pigment during dark adaptation. There are also change in the sensitivity of the visual system. During light adaptation, the pupil constrict to reduce the amount of light enter the eye and prevent overstimulation of the retina. The neural circulation in the retina also adjusts to reduce their sensitivity of light. This allows the visual system of function optimally in bright light condition. Dark adaptation, the opposite side occurs. The pupil dilated to allow more light to enter the eye, and the neural circular is the retina become more sensitive to light. This allows visual system to function better in low light condition. In addition to these changes, there are also change in the biochemical process involved in vision. For example, the amount of rhodopsin, visual pigment found in rod cells, increases during dark adaptation, which increases the sensitivity of the retina to light. This change requires the expenditure of metabolic energy and exchange of material with the pigment epithelium, as you mentioned. Other mechanism of dark adaptation includes: additional to the changes is visual pigment and the sensitivity of the neural circulation. There are other mechanisms involved the dark adaptation. As I mentioned, the size of the pupil changes your dark adaptation. In the dark, the pupil dilated to allow more light to enter the eye, each the retina. This can increase the amount of light ability to active the visual pigment and improve the sensitivity of the retina. Neural adaptation also plays a role in dark adaptation. When the light's intensity is initially increased, the signal transmitted by the retina to the brain also increase. However, this increase is rapidly followed by a decrease in a signal transmission. This is thought to be due to a feedback inhibition mechanism in the retina, which help to prevent overstimulation of the neural circulation. Overall, the dark adaptation is a complex process that involves multiple mechanisms work together to optimize the sensitivity of the visual system in low light condition. Thank you for watching my video.